gihang Pupumaho Eti mau ko tao malangan na ay hey ay
Promise by me not leaving you. Me promise by me no break him heart long you. Me be stop waiting you. Me by loving you. Long heart long me. Sorry too much for me making you cry. Sorry too much that you leaving me now. Que mama, me now me wrong, but me no less.
Hi, Mele.
Hello.
Tadi pe ka Alice.
Yeah.
Alice yan. Hi. Malo, Malele.
Madeline. Hi, Melifaiva. Hi, Alice. Thank you for the short notice, girl. Sorry. You're killing me.
Okay. Then wait. So.
Oh, hold on.
So we can start.
Can you hear me now?
Yeah, we can hear you loud
Better?
and clear.
Okay.
So we can start now.
Huh?
We can start now. You're on air
Oh,
right now.
I can't hear.
Ooh. Can you hear me now? Can you hear me now, Mele?
Yes, now I can.
Okay.
Yes.
Okay. Okay. Whamaloat ka moa I ho mo tuktaimi ka mo si ilava mai ke tau whepōtara no. Again, we can do this bilingual, you know. Whamalo lahi atu. And really appreciate the so-called SoCal, Pacific Islanders COVID-19 response team. Thank you, Alice, to make this happen. Malo apito mele si lava mai. So we can start off tau talanoa pe ki e COVID tahiva. And ko lave pe o ku mo osi mo kau tahau na hanga fa tana ke ngai fa matala mau inga fikau aki mo COVID tahiva. E ne whakawhikau aki pe amo tau matakari koe ne o mo te Pasifiki e Alice pe amo mele pe o ku whakawhiawhia ko uhi koe tuku mo taimi ka mo si lava mai ke tau whi inas aki e ngai tala noa le lei whikau aki mo COVID tahiva. So I would like to ask you if you can share a little bit about the data right now. How is it going? Both those are infected and COVID-19 vaccination. We can start off with that and we discuss throughout the 1 hour. Malo aupito Alice Tulua.
Malo, Emily, malo whamalot ki he le tio tonga, he tukwhanga maari e mai te uhu whanga pe whakatapu o sano whai atu he porokalamani, pe o whape e tānaki atu e whamatara te me hauani ki ha whahinga ilo pe o whaampe e tokoni atu ka ki mo tolu kotoa pe mo lava mai he whiawhini. Thank you, Emily. You know, I invited Medifaiva because she's on the ground doing a lot of our work from testing all the way to right now providing vaccination clinics to the community, especially in LA. Bay Area and even in different states. But you know, you know, data, especially around vaccinations that we have from our work. When we look at the case and death rates, when we continue to calculate it based on the population sizes, our rates are still higher than everybody else's, even though the actual numbers are lower, because the numbers are lower for all the other communities. I just looked at some of our LA County data, you know, that we've been tracking so far, and it's clear because we work really closely with the LA County Department of Public Health. Mm-hmm. And even between the 1st of July and today, there were 20 new COVID cases in Pacific Islander community in LA County. Wow. And so the truth is people are still getting infected. And last week, the county put out a report that 98% of the people that are getting positive COVID infection when they get tested are people that are unvaccinated. And 99% of people that end up being hospitalized because of COVID are unvaccinated people. And so you can understand from that data that people that are unvaccinated are more likely are the ones that are getting infected. And so far, people that have tested positive for COVID that are Pacific Islander in LA County. LA County because we keep track of all of that data all the time. You know, but if it looks like that in LA County, we can suspect that it looks like that in other parts of the state for our population, for our people, especially, you know, you know, everybody's gathering. We have a lot of graduations. Right. Churches are open again, and so at least for case and death rates, and even between, I think between June 1st and today, there were 4 new deaths that were related to COVID in the Pacific Islander community in LA County. So, you know, data in LA County, but you can imagine that it's probably very similar in our other communities. Right. In terms of vaccination rate, the state of California, you know, they but we have been challenging them because the data does not look accurate. For example, some of the data shows that that there is more than 100% vaccination rate in some of our age groups, which is impossible. And a really clear example that we're looking at right now, we just presented to LA County their vaccination committee, because they have reported that over 23,000 Pacific Islanders have received at least 1 dose of the vaccine in LA County, those that are over 16 years old. But when you look at the total population of Pacific Islanders in LA County of that age, there's only 21,000 something. So they're reporting more people that are Pacific Islander that are vaccinated than there are in the county. So we're working with our counties and with the state to help them look at the data more accurately. Now they're reporting us as high numbers. We in the community, and you know, Merifaiva can probably speak to this. We know that that's not, you know, even 75%. That doesn't sound right based on our interaction with our people. And so our conclusion is we're in the dark. You know, like if the data can't even tell us what we need to know. So the best thing for us to do is to keep on encouraging our community to get vaccinated, because the data can't tell us where we're at. We're in the dark. So the best thing we can do is just to continue to create clinics so people can get vaccinated and make it easy. And then, you know, come to programs like this.
Thank you. Malo apito Alicia, and as far as I know, there are more Tongans getting COVID-19 nowadays from our ward and other community gathering. Mele, go from Maloa to Mele, thank you very much for making the time. I know you're working with the community, especially in Los Angeles, and we love to hear from you, Mele. You can give us a little bit background about what you're doing in Los Angeles. I know there are other communities in other states that want to know more about what activities you guys doing there. Thank you, Mele.
Ala pito Emily pe fa malola ka alisi he fainga mari e koeni ke makau to ko wa tu he polo kala ma koeni Emily ma ho inga pito pe ia ke tau hanga communicate e tau me koeni ke tau kakai ke ma ho inga mari e ka ki nau tolu ai ma ho inga o e nau huhu malu e pena hanga pe kala alisi ki moa na kamata mai pe e ngawe ko ni me he tau ko si he kamata pe ko e COVID tahiba aki a e mau fenga pe ke tokon ke tau community fika o ke pa mo u tu fa me akai ke tokon ke ki nau tolu wa mai ke ki he testing of COVID-19 pa ku mahina pe ka ki moa na e Teki fu firma oai ho tau takai pe te nau whio mi ke nau siwi Ko hi pe ko ngahi li fia whakatonga pe ia na mau na tolu he puke. Ka kai ke mahino ka ki na tolu ko ka ilonga ko te sivi o ko te positivi o ku lahi lewa ngahi tokoni ka ki na tolu. Wa mai pe ki he tainimi ai lahi koe ni o ono whai koe ni o vaccine o huku malo i. Na ilo pe alisi e ma whetakai mai he tau ko o si o mai ke kamata e ta uni o wa pe ki hono ave ho tau kakai ki he ngai wheitu ke keho e la eini ke nau o mau e huku malo i. Pena ki whainga ta hono whainga e me koho tau kakai ke he taimi ta tau ko mea koe a aku kona e whai he nina aku kawa he fufua huku ko he ni. O kai ko ha healthcare worker au. Ka ko hui na aku kamata mai hono ai tufa mea kai me tau ko si o whinga o ake mo county mo ka he organisation ke pe hen. Panana hanga lewa o la wau o ko kau I he kau healthcare worker. Pea I Sanuari pe na kamata whake huhu I December. Pea kamata koe huhu koe ela e ni na ku kawa he huhu koe Sanuari. O whaka osi ki February pa ko tui na tahai e ngahi mea na whakalot lahi ake kakai ke nau uno mai o kau ke huhu ka pau nau sio mai ko kamata atu au he whenga ke promote huhu ka ki nau tolu kau ave mo whine e ki pa kamata pe hok family ai huhu malo I o tuina e kau ia I hono whakaloto lahi ki nau tolu ke ote nau ili fia he huhu malo I ka nau kau mai. But over these months, we have vaccinated thousands and thousands of Tongan people. Ka I taimi tatau pe, o ku kei toko lahi pe, ho tau ka kai tonga, e o ku nau li fia, o ka ki nau whima, e nau toko ke nau hofu malu. O au pe ke ngai organisation, hange ko ngai siasi o mau kau ki ai, o ke iai pe ka kai ia, o ku nau ke hanga pe nau tolo, o whakatai au ngai, ai hofu malu I, nau pehe pe, o kai kuna mo lele pe ki nau tolu. Ka koe kau mai o tua ka ki nau tolu, he ke ki nau kau nau tolu he huhu. Pea o ku toko lahi a pito pe ka kai ko nau omi nau tolu nau whanau, mi he tau tahaua ki o lunga ko nau osi huhu malu I ki nau tolu. Koe ahoni na mau whae huhu malu I na mau toko, I he toko teo tupu he ahoni. Ka ku alu pe taimi, pea moe holo hifo, ai kakai ko kua mai ko ke huhu malu. Meaning, ku os whakaava whoki e he state pa mo ngai whetu ke toi ofiangi ke nau ngahi api ke nau o huhu malu I ai. Hange ko CVS ko Walgreens ko whetu ofiat ko nau takitaha api. Ka koe kakai pika ni wofi mai ko ni ke he whetu ko ni mauhanga ko o ofa ke ki nau tol ai huhu malu I na wo mai ki ai. Ai ko steak center ia koi o sasi o sisukalaisi o kau maoni o ngahi aki muni o ngau e ako nau facility ki he huhu malu I ko iloi he kakai toko lahi ela eini we make it available ke nau lava mai ki ai tau te fito ki he I kai ki ai appointment kana e toko lahi pe kakai nau tamai pe whainga maari ke na wo me pe hofu malu I whetu ko eni. So ke te au, o ku neong o ku kei tō lahi pe ho tau kakai kau Pacific Islanders. Na tō lahi apito me hawa kau haamua o kau mai, pe na toi hanga pe he group na arisi mo mea. O make it available ke ngahi whetu ke he pe, hange ko ngahi sas haamua, ko ngahi lia pe I ela eini e ofi ki ai e tau kau Pacific Islanders hango kau Fisi ko kau Guamanian ko kau Marshallese ko pamoe kakai tonga pa mau fefi apito oko fefi apito he ngawe pa mo grupo ko ni alis mo me a SoCal Pacific Islanders pa uhi ko ngahi resources ko unau mau o to toko nahi apito ia ki te au I ta whaki ko ni neongo o ko ke tu to taha ka ko frampe alis ke toko ni mai ke establish a Tongan community I hen
Right.
ke uhi ke to whakaava a Tongan community he ko mahino pe ia oku lahi ngā we ia ke whai. Ka oku te kia i ke mau na ia i pe tongan community, unfortunately, na ai mahana e tāpuni e aris papa ke hanga o whapapaui pe koe maupe whia mau hasirin ke whai ake ngā we koe ni tau. At the meantime, I'm gonna hang here ke uhi ke iai hanga aue ai motoko ni mai in the future. But once that established, it will be a better and bigger, more beneficial for our Tongan people here in LA. Kako tui ko whakatoa peia o ki whamatala ko whai atu he ahoni. Emily, o whape ko taria to whehu ina, ko whehu ina ko he mea ke kau taria ta meke.
Kali whaka au pito e mere whaiva. Pe hange ko mea koe ok mo lawe ke hange ko mea tatau pe ok tau whi ao mo ia. A o si I whenga he na e mere whaiva ka o mafo ka alis tu lua. Pe au kai me alahi au te ongo I e kita ia. Tau te whita ke mau nofat koe ni me ta whaaki o wha mafola I he lea pa mo e ata. Ok whai pe tu kui ngata. Me I he tau ko o si mo whai ngai polo kalama. Ka koe mea o whakawhie whia a e te whanongo ko tā mai ha taha wahe mai ngai polo kalama. O, nei keke utu iau ki he huhu malu I ka koe ku whanongo atu koe ki lea mai a ki motor ko lea wha mea he ngai polo kalama pa ko loto lahi ai ki o alo huhu malu. Pea, ka koe mea mahu inga na o mai e mere. Ai mahu inga koe ho tau ngai community. Me ko whetu ko toa pe ia na iai pe Tongan community. Ai pa ko lawe I pe o lawe I pe alisi. Pa ko na o hake pe koe ni e mele. Ko pe area na iai e community Tonga I heni. Pea koe kau taki koe na nau pe koe nau tona nau tataki o ko siong nau ke I heni. Pe hange ko talo mahu inga koe kau whewhine. Ne nau kawai mo lea wha ko ane pasina. Ka ko mea maho inga hange ko na o kuke I whungawaka ko na o kuke iai e alisi. Do you see any difference whatsoever hange ko tau whenga mai a o ke census no ui e kakai ke nau tohi kakai a o mai en ke COVID-19. Pe o fie ma upe pe ko tahaia ai makatu ke anga pe ko palopale mai tau whenga ke tau wau ke kakai. Ko ikai ke aha whahinga organisation a community tonga oku ne hanga o tānaki ko toa mai community tonga, but not just a couple of people here and there putting up a Tongan community and then collapse after a year or so. Yeah. What do you think from the organisation? Ko la venga kau taha ngā lahi o ke kau kia e alis pe to tānak mai kia e Amerika. Hanai ho wakai kia e. What do you think we should do?
You know, there have been a lot of efforts over many years, over the decades, you know, to build a community, you know, ke ia hawhainga kautaha, nau toka ngā ia te hotau ka ngā hawhainga wheitu upen. But it's hard. It's really a lot of work to work in community-based organizations or in nonprofit. Right. You know, and I understand many of our people have to take care of their families. Mm-hmm. You will never get rich working in nonprofit. It's a lot of work for no money. You know, like pema whakata ko te ngawe ofa pe te ngawe he pahinga ngawe ko ni. And you know, that's just the truth of it. Is there are, you know, people are doing a lot of different kinds of work, mm-hmm. and more people are coming together to contribute to it. Only on nonprofit. So, so I think, you know, the church leaders are more open to, you know, you know, because I can say 10 years ago, it was harder for us to even have a conversation with some of our church leaders. They're busy, mm-hmm. you know, but nowadays when we have people like Merefaiva and people like Leafa and a lot of our leaders, you know, community, it's easier for them to get our church leaders to listen to what we're trying to do. And even the partnership, that didn't exist for us 10 years ago. So I think what's a little bit different now is that there are more people okuki matalang ho nau atamai ki feinga ko nok fai at me community pero now bag now loto la ke now tokon ni mai and don't have to create a nonprofit organization to do that work. But we do need more people to be to contribute to that work because it's necessary. You can't just have one organization. I think that's where we are right now. We have a couple that are sprinkled throughout the state. I think Taulama is in the Bay Area, Waipiki Kautaha'i, Riverside, it's called Malo. And the Tongan Community Service Center used to be in LA, but has closed down, and trying to help contribute, help Metafaiva build that back up, or create an organization. But you see that the same even in Utah. I think there's like 2 Tongan organizations. I think we need to do a little bit more of building in that way for our people. Heck, it's easier to if there's more people.
Right. I love it, guy, Mele.
Moana pita e lawa arisia ki ai ka koe kia te au ia as a real estate broker te ulava pea o kume ki ofisi ke ui koe Tongan community. Ka hange koe lau koe a arisi. It takes a lot of people to come together and make it work for everyone. He koe ta moa, koe first time ako kau mai koe ke mea koe ni he kamata pe me tau ko si e whenga takai holo. First out of my pocket to buy food and kind of help people out. And then finding out there are other organizations that they can help. And the more I put myself into it, the more I know it's like, wow, we really need help. We really need a Tongan community to call the one-stop shop for people to call and say, hey, I need food, especially with the pandemic was going on last year. People calling me. And I did the best I could to help them out. But at the same time, this is the Tongan community. And I didn't have a problem of calling it the Tongan community, but yet we are reaching out to the Hispanic, to the Blacks, to the folks out there who are not Tongan to help. Even with our food distribution, we give out more to other ethnic groups than the Tongan, because we have Tongans in the area, and most of them, they come, but some they don't come and receive the food. But my goal is, and Alice knows this too, I reached out to her to see what can we actually do to establish the Tongan community, at the same time having people to have the passion. It's all about having the passion to be able to help our folks. I was thinking of approaching young people, but they're too busy for, they work, they have school and all that. But I also was looking at the people in my age group. Can they be able to help? Some will say yes, yes, yes. But sometimes our Tongan people, when they say yes, it's a no. And I keep on believing that they're saying yes, that they want it to work.
Let's raise the
But
whole...
I think, it's like what the Palangi people says, eating the elephant, you have to bite it a little bit at a time. And there will be some other times that maybe the Tongan people will come together and reestablish the Tongan community that we're talking about.
Right. Hey, good. What I experienced in Ang ko whenga koe ni ai huhumalu I COVID tahi wa. Whae ai lau whenga o tari e San Mateo County ke whae ngai ai huhumalu I ko ulak taimi na sai au pito alu pe taimia ke to toko si yang. Pea ko mea koe ne mau whakatokanga I he tala noa holo pe o pe he o alu pe taimia mo ki to ki toko lahi mai ai ka inga tonga o kunau puke he COVID-19. And pa ko nau tolu ko nau puke for sure na te kai pike nau huhumalu I nau tolu. Pea o ko taimi ni whakafoi ai whenga hange ko mene lawe kai alisi ko mo wa ko me ko lahi taha ko ngawe ofa. Ko lahi taha ko ngawe ofa. Ka ko no fa he taimi ni alisi ko lawe pe mo lawe yang e mo wa ia ai ngahi matakari ke he. O no fa o manu and admire ai kau haamoa. I see them. O hange ko kunau to ki fa o taha. It's just what it's ko guanga benek wakai personally, not from a book. Go wakaya to ke ohake now organization is the Samoan Community Development Trust. This is another, and also they're kind of linking together, you know. Ogunau kind of okfenga aki e guanga ko wakai ko kia. Pea na aku lauhi for an article mahalo he how many months ago pea me Hawaii o pe he ka university ta ka wako university ko palpale mai a Pacific Islanders o gwiki na nga fata they have little group here and there ko ta por kala ma no fa he tai mini o fa hele dio Pasifiki. We call it a VTF Pasifika Global Media Network. O ku kehe au pito pea mele te o tonga, pa ko uhinga ai whakakaukau koe ni, ko uhi ke target the Pacific Islanders. Now o mai o whainau prokalama, and I'm starting to invite a organization, Pacific Islanders organization, ka mata mo tolu gai ki kau tahai he ni ko Bay Area Task Force, and ki kau tahai, maha kau tahai ne tolu pe whako ilo. O gai mo kau taha e mahalo o kua petolu I Seattle, o gai mo kau taha, and in Utah, o toi lahi ange kau taha. I think we need to do a study now to identify all those organizations o kunau ngawe ki he Tongans and the Pacific Islanders, so we can network. What do you think?
Yeah, I probably have a list of all of our organizations because we work together on different things. But kag mon beho lau Emily ko okutogosi yang ai ukau taha ko oku Tongan organizations. We don't have as many. Okutogola henge befo ka Amoa American he kau tonga. So and they've been here longer also, so, for example, the Samoan Community Development Center, it's probably one of the oldest Pacific Islander organizations in the country. It's been around for decades. I think they just celebrated over 30 years or something like that, or maybe 50, I don't remember, but they've been around for a long time and they're still here. Kapau na kay mauye Tongan Community Service Center ayon ko na LA. That one was established in the 80s. And so, we have, but yeah, we don't have enough Tongan organizations. Okulahi pe mawhingawe aki around different things. Hangi kun ngawe kun ketoy kakai na lahi mawhingawe aki mo we have a lot of different organizations, but we do need more Tongan organizations.
And I think we need Emere.
Yeah, I think Alice is right. We know Tongan know that we need this, we need that, we need more of stuff. The problem is, how do we start it?
Right.
How can we bring people who have the passion to serve our community without pay, just for a little while, in order to get lava, get tuuha fahinga mea whakatonga, ke lava ke tau fif popo waki ai. Pako hange ko o lava ane nai Emily, o ku hange o ki organize ange kau haamoa ia tau tō ngā pau hange o ku ki ma opo ange ai ngahi matakari ke he ia ki tau tō. Yes, you are absolutely right. He koe hange koe ni koe ngawa whakaaho koe a aku as a real estate broker, selling properties, buying properties for people. O ku whakatoka ngā i koe ngahi matakari ke he o nau lawa na tolo come together ke nau hanga o whakatahai ha fo i silini ke whakatau ake ha api ha tokotaha. Ke hua tokotaha ke kepe ke own that little family something that they can go and call it home. E ose foi tau e ua pe fia te whakatahataha pe ki family koe ni o whakatahai nau seniti ke tokon ke nau the next family. And that's how they build each other up. Ko tau tonga o mahino ke atea koe ulu aki pe foki ko Amerikani ko pau ke sai te grade D fika watu ko pau ke mau hati sirin ke whai ake taun pe meni ma mea. O ku neong o koe koe ngai whakaukau koe ni mga hei whakaukau ke langa haki o e family. It's there.
Yeah.
But the problem is like what I said earlier is how do we start it with what we have. Sometimes we don't have what it takes, but what can we do as a Tongan people to help our own people to get to that point of starting? Pea koe ku whafua pea ku moe ape gulau koe ni ke tau kakai koe ni heni hangi koe lawu koe au emeri koe ane nai o ma opo ange ai kau ha mua mai ngahi matakari ke he hangi koe lawe a alisi ane nai. They've been here for a long time. They know how the system works in America.
Right.
But at the same time, I think o tau tolo tau kakai, we need to start establishing.
It's ko me tangi au. Hange kongo e te tangi au i tau tala noa ko e ni ki ngai mea ko ni o ko ngai o ga ene whakawhela vei when we see how its impact I COVID-19 ia tau tolu. Yeah. If kapau na ai tau to more organized yangi he kai ke fu we sia pe he iki tau tolu for sure. Yeah.
Okay, if you're I always tell people it's not that we don't know. It's not that we've never done it before. You know, if you you see this exists in other places. Like hange kon ko whainga paanga whakakolo ko whai ko ke tokoni ki tonga. Moi u koristutuku. People know how to do that and how to come together and like feel mafana and give their time and energy to something. I haven't yet figured out why it doesn't translate to building for our people here. I think people can do it within, but I think I don't know why it's harder to step outside of that and to do it in maybe it's still too foreign. Maybe the structure of it is still too foreign. Maybe it's still too American. I'm not sure. Maybe you two have some insight on that.
I keep, I sabia go na ke o mai na ke send my Alice, yeah. So I try to talk about it hele diogo ngake mahu inga mali why we need to participate I ki sabia ko ya, and go fe la hengo go fe inga go ke talanoa ke mahino kapau, like for example kapau he ke ilo he kautakia o San Mateo County, what's going on with the Pacific Islanders. E te nau wahepe nau tolia e konga koula ke kakai ko oku nau ilo, how they behave, how's their in our health and our social, economic things like that. Mahalo na toto I don't know. I hope na okay pa ke kakai ko nga kana lava participate ko ta. And this is ko pa ko fo nga ni ko lava ko ke ta talai ke ka taki I hoki kolo, ka taki I he state. This is how we are. This is us. Eh? Pe e whai ngofua na hanga mai ke o mai e toko ni mo kau he ngai housing toko ni ke housing ai toko ni tuwha mea kai kono kau a mele. Pakapahe ke nau ilo nau toko then we are invisible. They don't come to the church or eke church leaders. How you guys doing? How eating behavior? How's the alcohol and the drugs doing with you guys? They don't go ask the church leaders in the church. They have to go through a channel and a system in place. You know, but e mao foi founga koia ke nau ilo ai tau tolu. Ha tau whakafonu ke tau participate henga sa vea ngoni. And pakotu yau e o fafine ko fainga talanoa ni o maho inga ke talanoa maupe.
Yes.
One way or another they will turn around. Oh, that's it. Tako tau hala ni pe ko te isi okay ko Amerika e tu mai ko fu nua maupaanga. They have everything. They have all the opportunities. Ngā whainga maari e mao hoto whare half pe to tongia e mao ai ka pau ka kia nofo anga kia whaitu te ulawa nofo ai kia ngai polo kalamaha. Toko ni me hafua. E tu me he, hange ko kia ka hafu vai ta whea tu o tau waha mo ngai polo kalama ko ia. And we sit at home o tau mo ua pehe tau ngai mea and thinking, oh, e ilo mai pe e President Biden ia, what I need. But, you know, ka koe mea kai ke tau whakatoka ngai e tau tolu, we have to organize tau community in a way. E lawa ke sio mai ai, even the mayor hoto veitu, oh, there they are. They need more help with smoking. I'm happy to dedicate this 1 hour. You come in or you invite anybody that want to come in and we can talk about this. Yeah, go whamalo heni ki so-called Pacific Islander na kole pia ka Neil. Neil ke fia sponsor pol kalama pa tatai pepe sponsor ka na tuku iha tu pea foi kore pe io pe ikai na io mai so-called Pacific Islander COVID-19 response team for the next 3 weeks. But I want to dedicate this. He go meno go whakatoka ngai. The money is there. Maybe from the media part, me mautolu, the media, the money is there. It's just a matter of kesi o mai a community I kautaki o fonuani that we have a Tongan community. Heke ki lava ia. He go mena whaatala he mau pulukalama ko whinga good whamahino ko gisavea. Come on guys. Heke ki lava I me ya ke hao. Whakasio ate api individual house. How you guys doing? Ko tuka tu peki loto ki homo. Hange ko mea ko ne kulava ki ai a mele I whinga ko LA. I think mau inga ke tau wheto koni aki. We'll see how we identify our resources mo toko tafe unga in Los Angeles that willing to help. Kai fuki tala tolo fusi mai hataka pa ye ka mai. You know. But this can be hange ko lau ka mere. We trying without failure to figure out how we can start. But I think we can start with this. Tau popo tala noa pekiai, invite people to come in and see what they say. Hange peni haki isa vea. Tukot peka moa malo alis. Bea mo mere.
I was just going to add that maybe, you know, as you're talking, maybe the hard part is you have to be an advocate.
Right.
You have to be somebody that's willing to speak up and mahalo, you know, that goes against the way that our people are and the way that we're taught to be as Tongans. You know, you're supposed to be, you know, angafratoki lalo, you don't speak up unless, you know, if you speak up, maybe, you know, people think that you're fiepoto. And but in this kind of work, you have to be somebody that tells the county, look, you're not paying attention to us. Or look, we need to have vaccination sites in our churches for our people to come. You have to be willing to be somebody that speaks up in order for the work to exist.
Right.
But I don't know, maybe that goes against everything that we're taught how to be as Tongans, and maybe that's why this work isn't as valued, is because it goes against everything that we're taught. You have to be willing to be an advocate to do it. I don't know. What do you think, Mele?
Yeah, Mele.
It's the way I have been dealing with the county of getting the Tongan vaccination site for us. Like what Alice said, it was not an easy thing to do. It's to negotiate with them to, hey, we have Tongan people, we have Pacific Islanders that we have our own needs, that we need to have our own, to where it made our people comfortable of going to, rather than sending our people all over the place just to get their hukumalu. Eh?
Right.
So once that was established, the rest was easy. And then we continued that work for them to come out with their nurses from the healthcare department of the LA County to be able to help us do that. But the first time, it was really hard. It's just like everything else. It's hard to get into something that even the county was not used to. They just shift everyone. They bundle everybody, black, blue, white, Tongan, someone, whatever, into different places. But when I come in and ask very specifically for our Tongan community, it's like a Tongan, Pacific Islander, yes. So now the hardest part is after that. Now it's getting the site done. It's getting our leaders, getting our churches together to say, hey, you don't have to make your own appointment, or you don't have to go to downtown LA or go to Pomona. You live in LA and you go to different areas for your vaccine. We have our own. You can go there. Now, that is fine. We have our own place that we can go to. It's getting our own people to get there. So it's sometimes what I have noticed from the beginning of the year, someone in certain family or a certain community, especially the Tongan, has to get sick from COVID in order for them to open up the rest and say, whoa, wait, I need to go get mine done. It sometimes it takes that.
Right.
You wake up with our kakai, ya mahino kaki now do ta ku sai pe ki famo ta wole ba hu malu so ko fere ni buke pe malo ene mo ui foki mai me fale mahaki oh na to gile ki ata me aki fale mahaki. So I need to get my family together and get the shot. Right. You know. Okay, I take out tonga he taini, and I know this for a fact. I know my people in LA. So Alice, I don't know if this is crazy idea for you when you talk to the county. I want to go to each individual houses that I know that they have.
I think they're starting to have. I think they're starting to try to have like door to door, like to actually administering vaccines in people's homes. We might ask for that.
Because I'm telling you one thing though. For me, I want to be Tawataina. I want to go back to what we used to be, knowing that we cannot be going back to what we used to be. I want to have the Tawataina for me.
Right.
I don't want my next door neighbor, my family next door to hold me back because they have not even got their vaccine. It's just crazy, you know. For me, we need some kind of system to where that we can reach to everyone. That's the hardest part right now. I talked to the nurses when we were doing the vaccine today. What can we actually do to make this all happen, to help our own people? Our 12-year-old and up, the talk from the parents who vaccinated their 12-year-olds and up, they're so happy now they're going back to school. They don't have to worry about them getting sick from other kids. Yet, at the same time, there are parents, Tongan parents, sending their children to school with no vaccine. Wow. They are eligible to get the vaccine. Now, we have been vaccinated the 12 and above. Now we're talking about the 6-year-old and above with one shot from Pfizer. Right. If they're not bringing the 12-year-old to be vaccinated, how about the 6-year-olds? Right. And I'm only talking about the Pacific Islanders, our Tongan people. How can we make them, hey, it's okay? I think it's a wrong word that I say, how can we make them? E anga whawhewhe hatau reach out kia ki nau tolu, ke mahina pe kia ki nau tolu, ko mea koe nau tui koe ki ai, o ku fu kehe kehe au pito ia, pa mehe ngahi tokoni koe ni utau whie mau ke tokoni kau kia ki nau tolu. You know, ko ngahi siasi I ela ein, it maybe it's like 40% that they have their vaccine. Some churches have 20. They still have 80% of their churches that needs to be vaccinated. And I am waiting for the day, Sunday, that I can go with my nurses and to the churches and say, okay, you haven't got your vaccine. Now it's time to.
Yeah, we might just have to end up doing that moving forward. Is have a vaccine site at a church on a Sunday after service.
That was what I was thinking of. They can put it there, and if
but then again, you cannot force people to take.
Yeah,
right. So how it just somehow that we need the church leaders. I mean, they're so tired. Si ose whawai e kau taki lotu. He tala whanongonongo mo wo mai ki he whai huhu mo mea at the same time be oku nono e pe kakaia, Kahe kai ke tuku ai e tau tala o available, because I can promise you this. Pretty soon the vaccine is gonna be, you're gonna pay for it to get it.
Yeah.
Just like the flu shots. Yes, you don't pay for it with your with cash, but it goes through your insurance. But I have a feeling that with the COVID, with the shots, you're gonna pay for it. My thoughts.
Yeah, I think I want to just add one more thing is that the Delta variant of COVID is what's it's a big threat right now.
Yes.
I don't know how much our people understand the difference between the virus, the original virus, and the Delta variant, which is just a different form of the original virus. That it's more transmissible. So you can, if you're unvaccinated, you can catch it easier. And in our community, we were already more vulnerable than everybody else because of, we've explained it so many times why our people are more vulnerable. But the Delta variant, which LA, put out a warning last week, the county suggested for people to wear their masks because it was really spreading in LA County. But our people, it's more transmissible and it causes more severe reaction. So, for our people that are unvaccinated, there's even higher risk for being affected by this new variant. And I know that the people, yeah, I don't know what else to say. I just wanted to share that in case people are not are thinking about it's the same old virus. It's not the same old virus. This is a different. No, it's not a different virus. It's the same virus. It's just a little bit different.
Yeah, they
Yeah.
Pego so hifo ke u state ni ihima u county ni ihange ko Florida u kamata ke now pause a hono reopen ko ya hono ngahi na ngahi business ko uhi ko kamata ke he ko hange ka ko county ko ni I Florida o ku kamata ke to mapunta ta mapunye na ngahi mohenga ko na ko ICU
yeah there was a Kansas City was saying that all their ICU beds were at maximum now last weekend after 4th of July and the states that have the lowest vaccination rate are the ones that are seeing higher COVID spikes right now.
Right.
Wow. It's scary. Kako hange ko lau. But when you have your vaccination, go have time go to get my vaccination. O ku te ongo if ki I fie maria. Okay, talape that we still need for God's sake ke tu be ho mask ke ngai fe tu. Ka ko ngai ka to anga ni fi ko was alwa ya ngai ka to anga ta matakari. Hardly anybody wear a mask. Ya ko koa o tu mask ma pe ko awe te mini o fa vai ke hono to e mask te mana varere but ko ke advice ya ko he time mini ai mau inga ko ya ke tu e mask ko tau por kala ma fo ko tala no COVID-19 hange ko yang mo me ai ho ek mo kainga ko te tau tala no tataki on fa fine ko ni tau tala no ai mau inga ko ya o ke fi mau pe ke tala no he o ku to kamata ke to langa ha ke to ko lahi pe kai ngata hange ko fa matala ko ne fa hoko e o fa fineni ko tau tolu o ku tau tu la vea ngofu ata we are the most vulnerable mago fo lea le ta haya ko ya ko tau tolu o ku tu la vea ngofu ata ki e COVID ta hi va talu pe me kamata anga ko inga ko tau ngahi se ke me hoko fisi that is scary ai me ko hoko fisi ta mini va veni pe hano ma o to ta hafe I fetu I ahota last week ko aneafi na to ko kula ngongo fa muy na to ko no ngia tupu ahota pe ko kai ko o kulolo tonga quarantine pe una tonga isolated I mean ko nga ko na COVID-19 to ni ma fetupu me to ni ma fetupu ko ya ko recover ko ta hafe ni mangiao pe since March. Recover is so low. Porque mate também cosa mate o fango full to count my pay me epeleri. Time ko na spike ai ko afisi. Porque me go hoko sio ko ke me go hoko ko fisi. Me ko ngai feitu pe ko suva me suva ki now sorry is specific place o klata ko to ai ka kai go ma COVID aiva. And people ko me go fainga ta hono o mai ko he na wongongo. Ko lahi ko ulaki o na ko le ke kakai e na ma ngai fa matala loi. Lahi kakai ko na fe hu malu I na to. Lahi kakai na ke opena to fai kava. Ko na fra hu pilisone o fono pilisone hono fra hu na to ko nga ko kai ke na fai ke ngai tutu uniko ni ai ngai fai ke ngai tutu uniko. Ma ka pa na tau no fa kata ha fo state ta. Na to opena tau mi hange ko fisi. When it goes up, it's gonna find out a bit on control. Ko hi ko tau ko time ni ka ke tau fa tari ngai fa ka ka ne ngo yang fa fine ko fa fake mo but the fa fake my mata I'll keep invite some people and go I'm not gonna give we will not gonna give up ke tau fa hoko to pe ai talan hanga ko mele te la ponga aki ai le tio ki ho o talanoa ko na fika ak mo faka amu pe au tatau pe mo Bay Area o ku faka amu pe to ko lahia ke iai ha community tonga ke to foko tu na au tatau to pe le ya moni na os foko tu pe le faka ofa pe to fa hifo pa te kai pe ke tanu ko tu mahalo fe ma pe ke to foko tu i o lunga ho ya ki me ki protein because ko ya ba tau to le tu ka te fa nga mari fa asika ki moa alisi pea mo mere.
E tuka peke whaka o sa te mele.
Malo mele. Mele koe kamata ni ho kau mai, ula kia konoa, ko whakaukau ke tua hau ki le tio a koe me LA, ke kumi mai ka inga LA, ke mo whakahoko polo kalama mai me Los Angeles. Mele.
Mili ko whamalo lahi atu whainga maari, whamalo atu alisi he whakaafe. Ka ko whiwhia lahi apu te peke kau mai mo ki moua he talanoa i isiu lelei, ka mo whakaafofa au pita. He koe kau penia ki he tokoni ki he tau kakai, ka ko tui mahalo koe lahiang hane ko lawe e mili. Koe lahiang e tau talanoa e umea koe ni koe ne toi lelei anga ia. Ki tau ke whanong ai tonga, pia koe toi whakaloto lahi e pe ki nau tol, ki nau whalala. Ki ngai tūtū ni ko o atu ko uhi pe ia ko whenga pe ia ke lelei whakalu fua ko ni maa tau tolu. Pia ko whamalo lahi atu ki he mea kotoa, o hange pe ko ulawe ane nai, kona ome whenga maari ki tau tala noa e ngahi mea koe ni. Kai whamalo atu e meliha no ome hoa taha koe ni donate mai ke tau lawe ai whikau aki pa moho tau kai ngā. Ka tau whenga pe ke tau hoka tu pe ke langa haki mo tau kakai tō ngā i whi whalala aki. Ka koe whakaamu ia ki iai peha taimi o ka pau te tau kapamatai ai whenga awe aki whakata. In everything that we do whakakai tōnga ke tau moi atu to ofi atu ki he ngahi hangi kone te tau hamoa, koe tau mahinga takari kehe, ki he tau ngawa whakataha ki tau langa haki ki tau tōtonga, i he whonua hau kone, koia pe mai.
Whamalo atu mele, malo e whamaupo opo whafo ofa e tau pokalama, ka ma alis, malo mo alis, ke kau hono teke, pe a koutui koe kamatain, whawhi peki moa i he wike ka hau, i he taimi tatau, o whalahi atu ka moa, ka mosi i malo loa, malo au pito.
Sa mata soben bego tokai no mutu mata ni diva. Sa mai buram bego tokai no mutu bale mana. Taki buasa, lala kai tamata. Kena le.
My soul yearn for her so much more, my love. I truly believe that the only way that we can survive.
Sully, Eva mighty pissy, Fika mighty pissy.
Back in the game, homie, one
Sip
more
so
time.
it's back.
Been gone for a minute, but I'm back.
Fika mighty pissy, kita ba alin suke. Asawa mo fele ile ang fight busy. Ile ka para si ay via ay ispan keke. Fika mighty pissy, kita ba alin suke. Asawa mo fele ile ang fight busy. Ile ka para si ay via ay ispan keke.
Yelwa saufa lai wakangi. Le asemele ang wafai ika kaule langi. Mahayale musika sipso usuai le pese. Musika sa moa eke fa apele pele. Fa eva ai tika fa eva musele. Shai kai iwa yai sipso with the flow. Le wafai sau yai. Sila coming a man. Peter with the one time. My rhyme is from the mind. I wanna get high like a cloud with good trees for bed by. My eyes are red bright and shorty, she so fly. I was just chilling, chilling like a villain without the killing. Sip so can you feel it? Low get still spinning, we ain't tripping. Cause dipping like show enough, puff some good stuff. I hope you're ready for us. Ain't no records coming tough, y'all ain't had enough. Still some more style, you heard it like wow. Me, I just smile. In the meanwhile, well, they all got power, cool, couple of money, wow, and I'm out.
Back in the game, homie, one more time. Been gone for a minute, but I'm back to shine. Back in the game, homie, one more time. Been gone for a minute, but I'm back to shine.
From February to January, we do whatever necessary for you to get into it. Move to it, groove to it, dance to the music. Baby, just lose it. Tell me, can you do it? It ain't nothing to it. All you gotta do is just go with the flow to the sounds of Sip So. Break it down low, touch your knees, then your toes. Bring it up slow, back that ass up, girl. Let me grind it for show.
Back in the game, homie, one more time. Been gone for a minute, but I'm back to shine. Back in the game, homie, one more time. Been gone for a minute, but I'm back to shine.
Masi samo. Shoo bap bap. Faali for fa'in. Shoo bap bap. Masi samo. Shoo bap bap. Atoa masi samo. Faali for fa'i. Atoma pilika kitu. Summer breeze for those in love. Oh yeah. Music plays until you hear that song. I say, homeboy, jam it to the tune of swing. See, listen up, Jumbo Jam
wanted was
That ain't right, this whole particular scene is too heightened. For me, I need my eyes to bleed to calm my nerves, yes indeed. Cause what I say doesn't mean a thing anyway. So I grab my switch and lay. When the sun goes down, when the sun, me and my baby got a smoking session. And then they'll take her on a night out of town. Oh yeah, we'll have a good time tonight. When the sun goes down, me and my baby got a smoking session. And then they'll take her on a night out of town. We'll have a good time tonight. You came and told me that you don't wanna stay, and you turned around and you just walked away. I never knew that the day would come when you would take my heart and drop me on the ground. Why you wanna break my heart? Tell me from the start. Why you wanna break my heart and leave me on my own? Why you wanna break my heart? Tell me from the start. God, please help me find someone who sees me as I am. Maybe you might think that this was just circumstances. Here I am believing that it was romance. Why did you even do the things that you do? When in your heart you knew that I would die for you. Why you wanna break my heart? Tell me from the start. Why you wanna break my heart and leave me on my own? Why you wanna break my heart? Tell me from the start. God, please help me find someone who sees me as I am. Now there was a time
Apo'o, ai e koporiaki sa kopo pia mi.
seeing you was my wife, walking down the aisle, but it was all a dream. With your funny style, you was focused on the cream. You should have seen the real deal, the true feel. Instead of steering my heart with hatred, you gave up what was sacred. Between us, you saw nothing but lust. Now you're dealing with something more dangerous. I'm losing my mind. Don't lose your head, just stay strong, my brother. I'm really doing the best to try. I'm only human, I do cry. God will provide all of your supply. 'Cause I'm a child of destiny, so I will give it all to Him. Why you wanna break my heart? Tell me from the start. Why you wanna
Bye.